Right. Again, good evening, everyone. So I'm here to discuss about very important topics, that is OET. Okay, because many of our colleagues who pass this MRCPCH and they have target to go abroad or like working in the UK, or sometimes someone having other intentions as well, but they feel OET is difficult part. So and I try to respond to the masses, but actually I feel that sometimes I could not appropriately messaged. So I need, it was my plan, long time dream actually, to plan to make something so that everyone get benefited. And here I have one of my good friend, my colleague, Dr. Anwar, who is from India and who recently completed OET. And me and Dr. Anwar was colleague. Sorry, it's not colleague. So I want to say
Yeah,
that
you can say
we
it.
were we were actually
You can say it.
the
Yeah, we
MRCPCH
are just
clinical. Yes,
yeah.
and he helped me a lot actually for the MRCPCH clinical. So, so when I heard that he completed OET, so I think that this is the best time, and he can guide us more fruitfully. And I will share something that we should do, and Dr. Anwar also. So it's like sharing our journey, or how to handle this OET exam, because OET exam is very, very important. Without IELTS or OET, whatever you say, that without English test grade, that is the OET grade B or IELTS, you have to get the 7 or overall 7.5. Without this, you can't take any job. Okay, so it's a very, very important thing. So it's need to be appropriately, and all of us, those who are clinicians, they are very much I mean, usually they are very much well and talented for the clinicals, or as a, if I say more appropriately, as a pediatricians. So we are very much confident sometimes with the pediatric disease and cases, but really English test, someone having, I know that they have to appear this exam 7 times, 8 times, and it's really difficult for them to overcome. But they completed a MRCPCH clinical within one go, but they feel tremendous difficulties with the OET. So let us discuss about it. But first of all, Dr. Anwar, please can you introduce yourself?
Yes, Dr. Morshida, thank you so much for giving me this opportunity to share my experience. I thanks a lot, and such a nice introduction about me. Actually, we both prepared together for our MRCPCH examination, and she's such a wonderful doctor, Dr. Morshida. And
No.
we passed much earlier, I think 2 or 3 years back, but I did my OET examination recently, and thank God, thanks Allah that I passed my examination in one go. And I also took advice from Dr. Murshida, because I know that she passed her OET examination in the January, I think, or maybe earlier.
Now,
So
February. Yeah,
yeah,
February I
February.
completed. Yeah.
Yes. So she was really nice to me that she explained it to me, and I always thankful to her for her help. Dr. Mushida, I just want to clarify that everyone here who are attending this session, everyone is preparing for MRCPCH or past MRCPCH, or there are some other people also who are doing this OET for lab or like medicines or other branches.
Yeah, most of them I think are from MRCPCH clinical
MRCPCH.
pathway. Yes, so
Mm.
I have a group for MRCPCH clinical general group. So I just
Mm.
give the link there and
Yes,
they
yes.
join. So they are in
Mm.
the pathway in from different countries.
Oh, okay. That's great. So, yeah, OET, I can share my own experience, but before that, it would be
Mhm.
nice to hear from the participants because we all are friends, and
Mhm.
I'm not teacher, by the way, so I'm
Of
just
course,
sharing my experience.
it's very nice. Yeah,
I'm just sharing my
really.
experience,
Mm,
and it would be nice that if the participants can ask questions, so it would be a
of
like
course.
dialogue, not a
Yeah.
monologue that one person is speaking everything and the other person is listening everything. Because many times, like if there is a collection of 10 people,
Mm-hmm.
the need can vary. Someone is just wanting to know about the structure of examination. Someone is just wanting to know about writing, and someone is listening, reading, or everything else. So
Mm,
it would be nice to get any feedback from them if they want anything, no, particularly, so we can go
mm.
through that.
Yeah,
Like
sure.
if they want
Uh,
to speak, they can speak. If they want to share the message through this message, they can do
mhm. Yeah,
also.
sure. So, if anyone wants to say anything, now you can open your mic and then
Yes, it would be nice.
participate.
Yeah. Anyone, please just ask anything, any question, any absurd question, whatever you want to know.
Okay, so it's happened like this usually, no? So let's start from your, I mean, how you started. And yeah, Dr. Raji, you want to say anything? No. Yeah.
Okay. Okay. So about my start, how I started my preparation.
Mm-hmm.
Actually, when I start, I
Mm-hmm.
think that MRCP, like this OET examination will be easy because I know that people usually pass in 1 month. Someone is saying that I passed my examination in 2 weeks. Someone is
Mm-hmm.
saying that I passed my examination in 2 months. Mostly
Mm-hmm.
the people say that they passed in 1 month.
Mm-hmm.
So initial impression was that I can also pass if they pass in 1 month. I can also pass in 1 month also.
Mm-hmm.
But when I start about knowing about the different parts and how we can approach
Mm-hmm.
the different parts, so initially my first impression was that I should start from listening because they speak very fast and we have to catch the appropriate words to fill in the blanks.
Mm-hmm.
The
So,
part
Dr.
A
Yeah,
section.
Dr. Anwar, I'm
Yes.
just here to interrupt because I want to make it very, very much structured. So, I mean, if you say that you want to, I mean, you will discuss about the listening and writing, how it would be and everything. But here I want to say that
Hmm.
people are saying it is 2 weeks, some are 1 month. What about your timing?
I took 3 months.
Okay. So I want to say one thing. It's 3 months or 2 months or something more.
Hmm.
Like I can remember that I require 2 months also. I mean, yeah, 2 months, but it's individualized. Someone can be
Yes.
required 6 months, so it
Hmm.
depends on like what is their basic structure of the English level, how
Yes.
and how much time they give, or some are their structure such a way they just understand the exam system and then they appear in the exam and then they pass the exam, but it
Yes.
is not applicable for everyone. That is a
Yes.
home taking message for everyone, please.
That
It
is
is
for sure.
not the 1 month exam or 2 months or 3 months.
No,
You don't
this is
know
not like
what is
that.
your status. Yeah.
In my own experience, it depends on how much background knowledge you have about the English previously from your previous
Mm,
background, that
mm,
how much you are proficient in English.
mm,
That is very
that's
important.
it.
From
Mm,
where you start, that is
mm,
important. So,
mm,
first of all, if you allow, I can say that the understanding the different parts, like we have 4 parts. reading, listening, writing, and speaking.
Hmm.
And in the every section, we need to pass, at least we have to score B grade. That is equivalent to 350 marks.
Hmm.
And each component have total 500 marks, and we should at least score 350 in that. Yes. So
Hmm.
350 or beyond that is supposed to be passed, and it is equivalent to B grade. B means that your score lies between 350 to 450.
Yeah.
And A means your score is beyond 450 to 500, between this.
Hmm.
So this is the score chart of every section. Uh,
Hmm.
it's whether it's writing, reading, speaking, and listening.
Okay.
And
So we have to get like B in each and every section.
every sections, yes.
For UK, you have to get in as a whole. I mean, listening, reading, writing in one exam, you have to get B. But in Australia exam, you can
Mhm.
give these things two times there, and they make some changes recently. I mean, they are taking C plus writing
Mhm.
for job, but it is
Mhm.
not for still for UK. You can still
Mhm.
require B for every grade. So if you get A even in one,
Mhm.
like writing, you get A, but you are getting somehow like speaking, you if you get C plus, you are not
Mhm.
eligible for the job. So that is the
Mhm.
requirement. Yeah.
Yes, at least every section you need to score at least 350. For
Yeah.
UK, I don't know about Australia and America. They may
Mm-hmm.
have different, but you can search on the Google that what at
Yeah.
least the score should be there for which country you are applying for.
Mm-hmm. Yes.
Normally, OET or IELTS is required for English speaking countries. They are very few, like Australia, New Zealand, UK, and America. Mostly the
Mm-hmm.
people are going there. So you can search in the Google that at least what should be the passing mark or what should be the grade in each section. But for
Mm.
UK, it is sure that you have to pass in each section with a B. At least
Okay.
350
Mm.
marks the people should score in each section.
Mm. Yeah.
Yeah.
So
Mhm.
first you can start with the listening. You said that listening was, you feel that listening requires some more time. Okay, so you can start with the listening, how it would be and what
Yeah, uh,
difficulties.
actually, I when I started my preparation, I was not thinking that listening require more time. But actually, my understanding is that the rest of the section will be easy. I think I have to tune my ears to listening first. So I practiced a lot about the listening.
Mm-hmm.
And then we realize that the writing, because when I sent my letter for assessment, it was C plus. In my opinion, it was good, but the assessment they gave C plus. So I was thinking that I have to improve my writing so that I can got B. At least in the second letter, it was again C plus. So I was confused that why I am getting even if I am trying harder and harder. And but in spite of that, the marks I obtained is C plus only. So that was frustrating. By the time I done with my listening, and it
Mm-hmm.
was approximately 30, sometime 32, sometime 37. It's varies, but it was
So
about
where you get this assessment?
listening or writing.
Anything? I mean, what
Listening is
difference?
I normally practice from this. There is a YouTube channel,
Mm-hmm.
Maggie Rayan. So
Mm-hmm.
every day, every alternate day, she posts a video for listening OET test,
Yes, I know.
and you can practice it. It includes all the sections A, B, and C, and
Mm-hmm.
total marks is 42, and you can practice in timed manner, that this is the time in which you have to listen, you have to write it. And then at the end, they also provide the answers. So you can match the answer, you can give your marks, that out of 42, how much marks you are scoring. So that gives you an assessment that how where you are lagging behind and how we can improve it. So
Okay.
listening is total marks is 42, out of which A section contains 24 marks, which is divided into two sections, 12 marks each, 12 question each. It's a fill in the blanks kind of questions. The two people are talking about a clinical scenario, and you have to you have to listen it carefully, and you have to fill the blanks with appropriate words. So mostly what I got
Hello,
assessment,
Walaikum
what I
Assalam.
learned from this YouTube channel.
Dr. Anwar, maybe can you you so
Okay,
missed it become mute. Okay. Yeah.
so
Continue, please.
yeah, I was telling about section A in the listening, and out of 24, we should target at least 20 marks, because section A is easy, and 20 is achievable. You can achieve 23 also. You can achieve 22 also, 21. 20 is adequate. If you bring 20 marks from A section, so you have to only bring 10 marks out of the rest, like section B and section C. And there is very good videos, YouTube videos, how to got better marks in section B and section C from E2 OET listening. So that I definitely recommend to everyone to listen that or how to do all these things.
Okay.
And meanwhile, Dr. Murshida, I think this is a kind of monotonous things. I would like people to ask few things, and then I can. So that would be more, I think, productive, because maybe people are not willing to listen about listening tests, and they are not. They are actually interested in
So,
writing, reading.
so,
Or
uh,
something.
I mean, it will be helpful those who are working on the OET.
Mhm.
So, I mean, I will list it in the YouTube channel, and then
Mhm.
those who are required, then they will get benefited. So here I want to say one things to you,
Mhm.
Dr. Anwar, that OET, whenever you are working with OET listening, though, so
Mhm.
you said that OET, I mean, some channel are really helpful, and you
Mhm.
said E2 OET, right? So E2
Yes.
OET, you have to, I mean, here many channels are official channels are there for the
Mhm.
listening. Okay, so if I write it, I think my screen is
Actually,
available.
yeah, type E2 OET.
Yeah, you have to
E2
just write E280, and then you will get many many
listening.
test or
And
how to do. So it is not like you are just blindly doing the listening part, and without understanding the tricks. So if we discuss about the tricks, it will not be work on until you work on the tricks. Okay, so I mean, Anwar said that it is 20, the listening part having A, B, C, and A is usually you have to making out of the words. By listening, you have to put in the, fill in the blanks like this. And also in the B and C, here you have to hard and you have to make a gist. You have to make a gist, and then you have to here not wording, here you have to understand, and then you have to make up the fill in the blanks, such kinds of things. But the things is, you have to work by this YouTube channel that I want to show, or I want to say it's very important. So the tricks how to do, if you just work on this, then your practice will be fruitful. Only if you are just doing the different channels and practice, it will not be that fruitful for the B and C. So I think, Dr. Anwar, are you agreed with me or not?
E2 OET, I think the name of the person is also there. E2
Doctor,
OET.
it is like, if I just show you something like OET official, if you just write it, then there is excellent. Always want to say these things. This official OET website, you have to write it, and then if you go through these things, and if you see, these are the sample tests. And it is for the listening, it is for the reading, writing. So if you just go to down, you see they have sample test. Okay, so there is sample test. Okay, listen
Yeah,
party,
double.
complete guide, blocks, listening party, complete guide. These are the, it's really very, very, very nice. They are explanation. If you just follow that, it will be very easy. But what happens, most of the people started to practicing, but it is not the start practicing. No, first understand how the exam and what you can do. And the blog is very nice, as well as you see here is the sample test. So sample test on paper, sample test on computer. So if you want to take computer and or whatever you like, you go to the medicine, and then you will get a lot of sample test. It is download. You can do the download. This sample test 1, sample test 2, and you see it is up to sample test 5. They give the answer key. So if you try one time sample test 5 and you understand you did not do well, that means you will again practice the same things you can practice. So like it doesn't mean that you can memorize every words. It is not like this. So then you will do other tests, and then again do the sample test, and you understand how is your situation. You have to get here, in the section A, you have to get at least over 24, Dr. Anwar. For the section A, I mean A, in the listening part A, it is over the 24. Na? Total
Yeah,
24.
total is 24. There are two segments. One
Two
contains
segments.
12 questions, one contains 12 questions. Total is
Here
24.
you should get at least 20 to pass this exam. And then B and C is difficult, but don't spare this. Try to understand. And if anyone here is struggling for listening, remember, it is not the practice. It is not the practice, and you will practice and do the exam. It's not like this. You have to work on the normal listening. Like you can hear some podcast, help podcast, or you can hear some sometimes movie, so non-medical things even. So someone having much more difficulties level, someone fail the listening part many times. So how they overcome by improving their English status. So you have to upgrade the English status. It's not the medical knowledge. So what you can do, you have to heard something other than the official or something. So you have to do normal listening, and then your ear will work on this, and then you can do this sample test. And these are the official. Okay, remember these things. These are the official. They have many similarity with the pace. So some said that their pace is very rapid, but in the real exam it's not that much rapid. You can get the word easily. Another things I want to say here, if you just see YouTube channel, many YouTube channel that are the authentic part. Okay, like OET online is very authentic. OET online, and if you just see that these are the this I forgot the name, but mm, is superb. His explanation is superb. Yes, the name is Steve. Steve is very good. So, there is other, that his name is Itu maybe Dr. Joy or something. No, it is not doctor, but Joy maybe. Can you remember Dr. Anwar? There is one person also very good. Yes, Dr. Jai. You rightly name it Jai. So Maggie Ryan and Itu listening with Jaya. Dr. Jai is very good, and um, if I write, then also it will come. The pictures is so well known to me and others as well. Yeah, this one. He's very good in explaining the things. So you have to first work on this. I mean, if you just listen the videos and all the iterate, you see, these are the things. If you just work on every video, you have to go through, you can make notes, and then then you will practice some, and every day you will try to understand what strategy they said and how can you improve your listening. Then you will one day you will understand that your listening level increases, because OET listening, the recording is not clumsy word. The word is very good, but sometimes they take Australian accent, sometimes different accent they take. That's the problem. So listen some podcast different. There is some news channel. So try to improve your English level, okay, so that it become more easy to you. Dr. Anwar, am I speaking too much? I don't know, but I'm just telling you that what is the way of improving the listening. But other things, the explanation one by one is given by them. We are not the official person, or we are not the actually the real persons to be help you, but want to show you that first go to them. They are making a lot of YouTube videos, so do work with them, then you practice, and side by side you practice, and then it will be easy for you, the listening part. Dr. Anwar, you want to say anything? Some messages are there.
Yeah, I want to say something like you are not supposed to bring 20 out of 24. This is not necessary, but in the
Hmm.
sense that this is not criteria to pass. But out of 42, you have to get at least 30 marks. So it would a suggestion that since it's a very easy to grab those marks in part A, so it would
Hmm.
be nice if you bring 20 out of 24. But this is not necessary. Many times you can bring 17, 18, but you did excellent in B and C. So this is acceptable. So the results depend on the combined marks of all the different sections. And at least out of 42, you need to score 30 marks.
Yeah.
Yes.
Hmm. So this is the listening part, and what about the reading part? Are you feel it is difficult, or
Reading, I think it was easy for me because
yeah?
mm, I
Listen,
did, yeah,
actually,
I didn't, I
it is
didn't.
easy for some, but some persons are struggling. I know them that they gave exam
For that
easily.
also, I would like to suggest to follow the E2 OET by J. Ryan to
Mm,
understand how to
mm,
uh, uh, part A, part B, and part C of the reading. It's a
mm,
very well explained video by him. So
mm.
you just see and understand how to perform this. And after one or two times, you got an idea that how to do it.
Yeah.
Um,
So you see that this is OET list, OET official, OET official OET. Okay. So here they sometimes make live session. They make live session, and they make they have. I mean, they are official partners. They take official partners, and they are making some. If you just go to the official OET, and then if you go through the videos, you see, um, here many videos, and these are the, like, it is shows, no, shows channel. There is SLC channel, website, they are website based. And you can take, I mean, you can take any of them, because they are official partner of the OET, those who are conducting exam. So they are the person to help you. And these are the official OET descriptions, that how to approach for success. It is for the reading, it is for the listening, it is for the writing, it is for everything. I mean, for passing the exam. And this is the, and for me actually, to know the official OET site was great achievement. I mean, this changed my vision or view, that how to deal the exam actually, that I could not sometimes explain appropriately through the message. Yeah, doctor. So reading actually, if you struggling for the reading, I mean, you cannot make the good marks. In that case, you can make a habit to read some English books, novel or some things. But for the OET, it's good to read some, case studies on something, and then how much you can make summary. So again, if you
Um,
feel it is easy, by practicing, then it's nothing to be worried. But if you feel difficult, and your exam is repeatedly you are failing in the reading part, so you can take help. Yeah, Dr. Anwar, please.
yeah, I was saying that don't go in so much details about reading a lot of material, because
Mm-hmm.
people don't have that much time. So
Mm-hmm.
yeah, it is better to understand the pattern, and to understand the pattern, it is very important to listen the video by E2OET with
Yeah. Okay.
Jayy.
Mm-hmm.
He explained the things very well, so you can understand how you can do it. And then there's a practice paper, practice collections of reading. You might have, Dr. Murshida, you can share to your this listeners in your group the listening material, sorry, reading material, JSON file. If you don't have, I will share it to you, and you can
Okay.
share. People can
Yeah.
practice that.
So,
So that would be a nice idea, because reading too much journal, too much book, that will kill the time.
no, actually, Dr. Anwar, it is
Mm,
for generalized, um,
mm,
like whenever I practiced, reading was very easy for me, and always I get good marks. I did not practice too much. But some people failed several times only for the reading. So, I mean, the story is when you know the story for many persons,
mm,
then you can understand that yes, someone can have difficulties, someone having difficulties in the listening, so they are failing 4 to 5 times only for the listening. That means they have really some basic I mean, basic problem in the listening, so they have to improve. You understand me? So I see that people are struggling mainly for the listening, so that's different. But some people are getting finding it difficult, and then they will practice. Otherwise, the main things is to understand the exam questions, okay, and then proceed. It's not required to practice too much materials, even anything. So the things is to understand how the exam system and what tricks you follow. And this, I mean, this YouTube, different channels that Dr. Anwar said, Jai, very good. So that can help. Yeah, that can tremendously help to understand. Then need not to be practiced. So if you get within the practice time, you get like 30, you have to get 30, right, Dr.
yes.
Anwar? Yeah. So if you get 30, more than 30, sometimes 35, more than 35 even, so you will be comfortable. Yes, I will do better in the exam. No problem like this.
Hmm.
Yeah.
And the next one is uh, writing, and the other one is
Speaking.
speaking.
Mm.
And for the speaking, I think just to speak to anyone, But then practice with anyone, you can just improve the fluency and avoid the filler words and avoid the pauses. So this can be done by speaking to yourself just to improve your speaking abilities. And
Mm-hmm.
and the important thing is to understand the structure of the
Mm.
speaking tests. So
Again.
they do marking on the basis of certain thing. There are linguistic and communication skills criteria, two criteria,
Mm.
linguistic and
Mm.
communication skills. So linguistic is actually assessment of your English, in which they have four different subcategories like first is fluency, second is intelligibility. Intelligibility is a kind of thing that how easily people can understand you without
Okay.
putting stress on ear. And the
Mm.
third parameters in the this is incorporating patient's question and then elaborating to patients. And there is also a fourth criteria. So this is about linguistic. And
Mm.
regarding communication skills criteria, they mostly uh, four or five criteria they have. The first is how you greet, and then how you are taking information from the interlocutor or the patient, and then information giving and empathy questions, checking
Mm.
understanding. So all these criteria you can get from the official OET site. Mm,
Mm.
these are the criteria, and you have to show them
Mm.
that you know the things, and you can grab the marks in those aspects.
Yeah.
So the speaking is, I again summarize, a practice. You have to speak frequently to check
Mm-hmm.
for any fillers and filler word or long pauses or unclear pronunciations of the word. And then you have to need to have to write certain sentences of sympathy and empathy. If the patient is worried, you have to say some sentence or phrase to let the patient understand that you are empathizing or sympathizing with him or her,
Yeah.
and
So
then checking the
similarity in the
understanding.
so there is some similarity in the clinical exam, right? That we did for
Yes, yes.
communication. Yeah.
But there they focus on clinical matter, but
Mm.
here they focus on the
Yeah.
language. That's why.
Mm.
But in
Mm.
addition to language, they also focus on sympathy, empathy, checking,
Mm.
understanding, and then
Mm.
summarizing and introduction, like that.
Mm.
So
Yeah.
there are definite parameters on the basis of which the speaking abilities will be assessed, and you can get this parameter from the official OET website. What are the
Mm.
criteria and how you can show them criteria. The one
Yeah.
thing I want to say is about when you are saying something to the patient or interlocutor, actually interlocutor, which is a person in front of you, and your voice will be recorded for marking, not your videos. So no any hand gestures, no any facial expression will be recorded for marking. Only your speech will be recorded. So when you
Mm.
are saying something, uh, or when the interlocutor is saying something like, "Doctor, I'm worried about my pain, and this pain is worsening since last few days, and I have this pain since last 10 years, but recently it get worse. I really worried about my pain. That what causes this pain?" If the patient is saying like this in flow and explaining the issues, you have to say something. Okay, I see. Just to let the patient, just to ensure that you are actively listening. This is important.
Very important. Yes.
And the first thing in the communication start with the introduction. So you have to find that whether this patient, when the role play will be given to you, you have to find it out that whether this patient is coming for the first time, whether this is a follow-up patient, or the communication started midway. So these are the three things.
Mm-hmm.
So this is all about the speaking. and then
mm,
the writing. I think writing is the thing which cannot be explained verbally.
mm.
Yes,
Need practice.
this is a practice and
Yeah,
marking that also require marking 350 out of 500.
yeah.
So,
Mm.
yeah, Dr.
But
Murtaza, you can continue forward from here onwards. And if anybody can ask questions from me, they can ask directly.
yeah, you can anytime ask questions. But Doctor, you said that you were struggling for the writing part, and they gave, I mean, less marks to you, no? After
It,
then, you improved.
mhm.
So, what
Ye-
changes that time happened that you are then getting B plus or B?
Yes.
Um, yeah. So
In my first two letters, in the first two or three or four letters, they give C plus. C plus is between 300 to 350 marks.
yes.
So they give feedback on the letter that why your letter is scoring less.
Mm,
So it's a
mm,
mostly about the article or sometimes the tenses.
mm,
So when I improved that, the score jumped.
yeah.
Yes.
Okay. So actually, writing part is not difficult, and it is usually it is the easiest part. And it's like in the IELTS, we know writing is difficult, but OET is not like this, because here just you have to follow the structure. Like you are making referral letters, or sometimes gestures letter. Sometimes it come like as a gestures letter. So there is some structure. Again, you can go through the JOET channel and other OET channel that I said you, that Steve having very good YouTube channel. I mean, in the YouTube channel OET online, and they having one teacher that is name is Steve, who explain very nicely, and others also there. Actually, it's my nature that when I do something, I read, or I mean, I try to understand everything about it. And for that reason, I learned or I listen a lot of YouTube videos, and I see that if you understand the structure, then it become very easy. So in a nutshell, I want to say, if you go through the official OET channel, official OET their website, you will get a lot of materials. Don't search only the materials only, what some letters only. So you have to search on the official site, and official site sample test 1, 2, 3, 4, 5, and this reference will tremendously help you. If you go through one time, you will understand. And the official OET YouTube channel, they referring some persons or some YouTube also, so you can follow this. And it is not very difficult exam, it is easy exam, but your test have to be changed. I mean, as you are like to read pediatrics, so maybe initially you will find difficult, then it would be easy. Anyone have want to say anything? uh, so yeah, so now it is time to take to say goodbye. Dr. Anwar is busy. I'm busy. So in the meantime, if you have any query, you can ask. If not, then please make prayer for us. Okay. Thank you, everyone. Dr.
Thank you,
Anwar.
Dr. Mushfidah. Yeah, thank you
Yeah.
so much.
Thank you.
Yes.
Good night. Bye.